Good evening, everybody. Welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jacos. Today, I'll be doing the continuation of one-sided disease, the part 4, that is the treatment of the chronic disease. Well, so in the last video, we had seen treatment of the local disease. Previously, we had seen treatment of the local maladies. So Hahnemann also has given the treatment of the chronic disease after the treatment of the local disease. So all chronic disease develop from the great three miasms if we exclude the causes of unhealthy mode of living, aphorism number 77, and also those innumerable medicinal maladies, aphorism 74, caused by physicians of the old school. So therefore, he says that all the chronic diseases in mankind, they are because of the three great miasms, psora, syphilis, and psychosis. And he said, we have to exclude the unhealthy mode of living and also the medicinal maladies, which are caused by the physicians from the old school. So if we exclude all the other causes or these causes, that is the unhealthy mode of living and the medicinal dyscrasias, then the chronic disease will only develop because of the three great miasms, that is psora, syphilis, and psychosis. Furthermore, he says psora contributes to nearly 7/8 of the chronic diseases of a non-venereal character. So as you all know, the psora is the mother, father of all the chronic disease. So a large majority of the chronic disease are psoric in nature. That is 7/8 of the chronic disease. And only a small part, 1/8 of the chronic diseases are venereal in character. So psychosis and syphilis, miasm, contribute but a small percentage. Each of which was already in possession of the whole organism and has penetrated it in all directions before the appearance of the primary vicarious local symptoms of each of them. So he said that, what Hahnemann says that these three great miasms are there and it is already present in a latent state in the individual, and it has gone in all the directions and has permeated different parts of the body, and there's an appearance of the primary vicarious local symptom. Example, in the case of psora, the scabious eruptions are there. So internal cause of psora and the penetrate in all directions for the scabious eruptions present all over the body. In syphilis, the chancre or the bubo, and in psychosis, the condylomata. So these are the examples what he is giving. The chronic miasmatic disease is, if deprived of the local symptoms, are inevitably destined by mighty nature sooner or later to become developed and to burst forth. So therefore, he says that in the chronic miasmatic disease, if the local symptoms, they do not appear, then nature will step in and by destined, they will develop a local chronic symptom and it will burst forth. So therefore, this local chronic symptom has to be present in order to preserve life, thereby propagating all the nameless misery, the incredible number of chronic diseases which have plagued mankind for hundreds and thousands of years. So therefore, he says that the miasms will produce the misery of many, many innumerable chronic diseases, and mankind has grown or it has plagued mankind for hundreds and thousands of years. So different diseases are pertaining to different miasms which mankind groans year in and year out. This could be avoided if the physicians treated the disease in a rational manner. He said, however, this could be avoided if we would treat it in a rational manner. Rational manner meaning what? By finding out the characteristic symptoms, forming the totality, and giving the indicated homeopathic dynamized medicine. Thus, cure would have been radical. The three miasms would have been extinguished in the organism by the internal homeopathic medicine suited for each of them. So he says that if you have treated the disease in a very rational manner, that is with the homeopathic system of medicine, then the cure would have taken place in the most radical manner and the three great miasms would have been extinguished. And there is no need for employment of topical medicines for the external symptoms. The homeopathic physician never treats one of these primary symptoms or chronic miasms, nor yet one of the secondary affections that result from their further development by local remedies. So it says that the homeopathic physician will never treat either the primary symptoms of the chronic miasms nor the secondary affections that will result from the further development by local remedies. He cures in cases only the great miasms on which they depend, whereby its primary and also secondary symptoms disappear spontaneously. So the homeopathy physician will not apply any local remedies on the local disease or on the chronic miasmatic local disease, but he will direct his cure to the great miasms which are present in the interior of the organism, as a result of which whatever primary symptoms are there and whatever secondary symptoms are there, those will disappear automatically. So primary symptoms of miasm meaning what? Those symptoms which are there because of a specific miasm and no suppression has taken place. So whatever symptoms are there, they are the original unmodified symptoms of the miasm. That is the primary symptoms. Secondary symptoms are what? When the primary symptoms have been suppressed by the conventional modern medicine, it gives rise to secondary signs and symptoms. So please remember, primary symptoms of the miasm are those which are not suppressed, or in those symptoms which disappear when homeopathic medicine is given. And secondary symptoms, they come only if the disease has been suppressed. So you get symptoms of the primary symptoms of psora, and also you get the secondary symptoms of psora. Similarly, primary symptoms of psychosis, secondary symptoms of psychosis, and also for the syphilis in the same manner. The old school practitioners did not pursue this mode of treatment. This was because the primary symptoms have already been destroyed by them by means of external remedies. So whatever primary symptoms are there, they had been destroyed. And the old school of medicine, they do not give the internal treatment. Now they only have to deal with the more secondary ones. That is the affection resulting from the breaking forth and development of these inherent miasms. So what are the old school practitioners now treating? They are dealing with more of the secondary symptoms. That is what? Those symptoms which are as a result of the breaking forth and development of the inherent miasms. So the inherent miasms are there. When the miasm has been suppressed or when the primary symptoms have been suppressed, it gives rise to the secondary signs and symptoms. So what are the old school practitioners dealing with? They are dealing with the secondary signs and symptoms because the primary symptoms have totally been destroyed by the external remedies. Dr. Henneman says that if the reader wants further information, he can refer on his work of the chronic disease for more details. Before commencing the treatment of chronic disease, it is necessary to make the most careful investigation. So in a long footnote 120, he has told you what investigation would be necessary in order to treat the chronic miasmatic disease. So let us see something about the word investigation, footnote number 120. In investigation of this nature, we must not allow ourselves to be deceived by the assertion of the patient or their friends. So he says that when you are investigating the case or when you're writing down the history, he said, do not be deceived by the patient's friend or relatives, whatever they tell you. Why? We shall see. They frequently assign as a cause of chronic either a cold, caught, a thorough wetting, drinking cold water after being heated many years ago. So their friends or relatives may tell you that this chronic disease arose because he caught a cold, either by getting himself wet in the rain or by drinking cold water, or after he was perspiring, he drank cold water, and as a result of which he has got this chronic disease, or from a fright, sprain, or vexation, sometimes even a bewitchment, etc. So they may also tell you that there was a history of some fright or a sprain or some troubles or some worries, which may have given rise to this chronic disease. It should be remembered that these causes are much too insignificant to develop a chronic disease in a healthy body. So all these causes of exposure to cold, getting wet in the rain, getting heated, fright, sprain, vexation, etc. Remember, Dr. Henneman said that these causes are too insignificant to develop a chronic disease in a healthy body. Also, furthermore, to keep it up for years and to aggravate it year by year. So these causes cannot cause the chronic disease, and they cannot, or rather, these causes cannot even maintain the disease for years and to aggravate it by year to year. Just to conclude, you must remember that all chronic disease develop from psora. So you have to, the physician has to be kept in mind, whatever investigations he's doing in a case regarding the cause of the disease, whatever cause has been ascribed by his friends or relatives, these causes are not sufficient to label the disease as chronic disease, or even to maintain it for years to years, or from year to year. But it must remember that all the chronic disease develop from the psoric miasm. The miasmatic cause of psora lies at the root of all the chronic disease. So the main cause or the root cause of the disease is the psoric miasm. The assigned cause, as mentioned above, could only rouse into activity the latent chronic miasm. But he said, whatever causes the physician or the friends have told, like exposure to cold, drinking cold water when getting heated, sprain, vexation, etc. He said that these causes could be only the triggering causes of the chronic miasms, which lies latent in the individual. So in the individual, the miasms are there, they are lying latent. Latent meaning what? Inactive, they are slumbering, they are sleeping, or they are in an inactive state. So they become roused into activity when these exciting causes are there, becoming overheated, drinking cold water, exposure to cold, sudden prolonged vexation, prolonged grief, etc. All these are just the exciting causes which will trigger off the latent chronic miasm. So these causes cannot be ascertained to the chronic disease, but the only cause which can be ascertained is the miasmatic cause, which Dr. Hahnemann wants us to say in regarding investigations, footnote 120. Furthermore, he says, when the above information has been gained, it still remains for the homeopathician to ascertain what kind of allopathic treatment has up to that date been adopted for the chronic disease. This is also very important. Also in today's practice, is also very important because we get mostly the cases which have been taken, the modern medicine or the allopathic treatment. So Dr. Hahnemann has said that you also have to gain information as to what allopathic treatment he has taken. Also, what mineral baths have been used and what effects it has produced. So during Hahnemann's time, as you all know, the modern medicine wasn't very, very well developed. They used to use crude methods of treating the patient. One was the mineral baths. So mineral baths of sulfur were used, and the external lesions used to disappear, but the disease was traveled from less important organs to the more important. This is necessary in order to understand the progression of the disease. So this is very important because you will understand how the disease progressed from what layer to what layer, from the mind to the body, body to the mind, etc. Before commencing the treatment of chronic disease, it is necessary to make the most careful investigation. So again, I repeat the first sentence which Dr. Hahnemann has said, that before commencing the treatment of chronic disease, it is necessary to make the most important careful investigation. Footnote 120, which I just explained, investigations regarding the cause of disease, that is a miasmatic cause. All the other causes which are ascribed by the physicians or the friends, they're nothing but the exciting cause which triggers off the latent miasm. Now, investigation as to whether the patient has a venereal infection or an infection with condylomatous gonorrhea, that is the psychotic miasm, for then the treatment must be directed towards this alone, or when the signs of syphilis or the rarer condylomatous disease are present, but this disease is very seldom met with nowadays alone. So out here he says that you have to investigate which miasm is present. Mostly, Dr. Hahnemann says that you will get the psoric miasm. However, you may also get the venereal infection of the psychotic miasm, and very rare, the syphilitic miasm also. If such infection has been previously occurred, this must be borne in mind that psora is always present. So he says that if such infections have occurred previously, you must always remember that no matter whatever miasm is there, psora is always present. That means what? as psora is complicated with the former, that is syphilis. So psora can be complicated with anything, with the psychotic miasm, with the syphilitic miasm. Okay. Thus, the internal dyscrasia, that is psora, is far more frequent fundamental cause of all the chronic disease. So he's justifying himself, Dr. Hahnemann is justifying himself by saying that psora is the most fundamental cause or the most frequent fundamental cause of the chronic disease, because as I told you, psora constitutes 7/8 of the chronic disease, which is of a non-venereal in origin, and only a small percentage, 1/8 of the chronic disease, which are venereal in origin, that is syphilis and psychosis. So Dr. Hahnemann always harps on the point of the psoric miasm, which may be complicated by the syphilitic or the psychotic miasm, but it is rare. At times, both miasm, psora and syphilis, may be complicated with psychosis in the chronic disease also. So out here he says that both miasms you may get, psora and syphilis, and also the psychotic miasm. In a great majority of cases, psora is the sole fundamental cause of all the chronic maladies. So again, he reminds you that he's saying the majority of the cases will have psora as the sole cause of the disease. They may be called by different names. So different names are given to the psoric manifestations. They are moreover often bungled, increased and disfigured to a monstrous extent by the allopathic unskillfulness. So whatever symptoms are there of psora which are coming up, or whatever different names the old school physician used to give them, they were bungled, or they were destroyed, or they were increased, or they were discovered, or they were scarred by the unskillful allopathic treatment. The age of the patient, his mode of living, his diet, occupation, domestic position, his social relation, and so forth must be taken into consideration. So this also tells you in episode number 5 that in a chronic case, you have to take into detail all the patients, all the different aspects of the patient, including the mode of living, the diet, his occupation, his domestic position, his social and relation, and so on and so forth. That is what in depth you have to take the case. You have to treat man as a whole. This is necessary in order to ascertain whether these things have increased his malady, favor, or hindered the treatment. So this will tell you that whether the disease has been increased or it had been hindered the treatment. In a like manner, the state of his disposition and mind must be attended to learn whether that presents any obstacle to the treatment or requires to directly encourage or modify. So furthermore, he says that you have to identify the disposition of the patient. That is very important. Okay, whether he has a joyous disposition, whether he has a melancholic disposition, so that has to be discovered, or it has to be properly perceived by the physician. Disposition word we will go in much more in detail in the 6th part when I do the mental disease. Further reference to disposition is given in episode 213, footnote 122, under the heading of mental disease, which we will see in the next video. This will help the physician to trace the picture of the disease as completely as possible according to the directions given above. So if he uses this direction in a proper manner, he will be able to treat, he'll be able to find out the correct totality. This will enable the physician to get the most important, striking, and peculiar characteristic symptoms. So this will enable the physician to get all the PQRS symptoms. With it, he selects the first antipsoric or other remedy having the greatest symptomatic resemblance for the commencement of the treatment, and so forth. So when the characteristic totality has been formed, whatever miasm is there, accordingly, he will give the first antipsoric or the first antipsychotic or the first antisyphilitic medicine, depending upon what miasm is there. So as you all know, Hahnemann has always harped on the fact that psoric miasm is responsible for 7th of the chronic disease. Therefore, he says you have to select the first antipsoric, because majority of the chronic diseases are psoric in nature. They may be modified or accompanied with the psychotic and the syphilitic miasm. So that's all for today, or what he wants to say in the treatment of the chronic disease. Now, the next part of part 5 will be coming up, in which I shall be telling you certain important aspects of Hahnemann with respect to mental disease. So please be patient and wait for part 5 to come up. Thank you.